Marquita Little. I'm the Health Policy Director at Arkansas Advocates for Children and Families. So Congress has been debating a plan to replace the Affordable Care Act, or Obamacare as many people know it. And we've heard a whole lot about how this will impact coverage for adults, but we haven't talked as much about the impact it'll have on kids. Today in Arkansas, we can celebrate huge gains we've made covering kids because over 95% of kids in the state have coverage. And a lot of this is because of the Medicaid program known as Our Kids First in Arkansas. More than half of kids in our state are enrolled in the program. But we also have a lot of kids who gain coverage through Affordable Care Act plans. Many of the parents were able to go and enroll in affordable plans on the health insurance marketplace, and many also qualify to get some assistance paying that premium. So one of the most immediate impacts we would see if the Affordable Care Act, or ACA, were repealed is the number of kids in the nation who are uninsured is projected to double. And in Arkansas, that means we'd be taking a U-turn on all of the progress we've made. So you're probably wondering, but what does the Affordable Care Act have to do with kids losing coverage? Why would that number double? Or number one, a lot of kids are enrolled in programs that were created as a result of the Affordable Care Act. Again, a lot of those are just simply being enrolled in private plans on the marketplace. Number two, in addition to actually creating some coverage programs for families, the Affordable Care Act includes a bunch of consumer protections that ensure kids who are eligible today can remain eligible in the future. And the third major reason, it's because when parents are covered and caregivers are covered, kids are more likely to enroll in coverage, stay covered, and get access to important preventative care. So the Medicaid program, as it exists today, is specifically designed with kids in mind. For example, certain Medicaid services are mandated, like ensuring that kids get those early screenings, and that allows any childhood conditions to be identified and treated early. Those types of preventative services cost a whole lot less. Here's the other reason why the current healthcare system we have and those coverage options are important. So one health crisis could create huge economic distress for families, many of whom are already living on the brink of poverty. So as lawmakers are shaping and considering the future of the healthcare system, it's really important that we keep kids in mind, because the investments we make today in ensuring kids in Arkansas and around the nation have access to affordable, comprehensive health coverage ensures that those kids can have a healthy, productive future, and it also ensures that we have a thriving economy.